Thanks.
Can I welcome you to this meeting and also welcome everyone in the public gathering? Can I remind everyone that all mobile phones should be turned to silent during the meeting? Please note that the meeting is being filmed and recorded. Therefore, can I ask all members to ensure that they use their microphones? Item 1, the minutes. Are the minutes agreed?
Agreed.
Item 2, declarations of interest. Item 3, the mayor's communication. Can I please note these? Recognition of community achievement. Can I invite Councillor Mike Murphy to say a few words?
Thank you very much. I'm delighted to stand regarding recognition. It's something close to our heart in Knowsley Council, and that's a social enterprise organisation, which we, as I say, very close to our heart. It's a cafe, the Courtyard Cafe in Kirby. Now, who they are, you'd say. The idea came about when the Music and Care, well known on Merseyside, the work they do, and the Knowsley Council's workplace health programme highlighted the lack of healthy food which is available in the Knowsley admin area, the industrial park. So, great minds got together, and a vacant unit was found, kitted out kitchen-wide, cases-wise, and then became the Courtyard Cafe, which has been very successful in the past few months. It's got a number of objectives. I did say it was a social enterprise, we all know the background, but it's worth pointing out to about the Courtyard Cafe. Who does get it? It gives training and employment to work experience to people who are sort of distant from the workforce, you know, learning disabilities, individuals who have mental health problems, or young people who need on education or employment or training. So it's encompassed them, and the skills they will learn there are the best part of their future life. The menu, I say I haven't been there, so to be started. I'm assured it's all fresh produce, locally sourced, by the way, locally sourced, and it's just now it's become a business hub, not just a cafe. It's offering free Wi-Fi, usually, and a soft meeting zone, which is quite attractive to the employees around the Kirby area. Obviously, a cafe or any business has to pay its way. Now, the profits from the cafe are being redirected, social enterprise, are being redirected into the buildings, the cafe itself, and most important to the like of us in there, is paying a proper living wage, which we endorse wholeheartedly. So, successes so far, from what I can gather, you know, it's well entertained by the staff of the local area, and God's sake, all the food, the low fat sugar, contribute to the health of the employees and the industry. And it's using health issues. There's a high profile in Knowsley, especially as obesity and diabetes are high in our own area. So a good scheme. But last but not least, Knowsley Council I'm repeating myself, Knowsley Council has an ongoing commitment to social enterprise, cooperative principles. It's close to our heart. And this is one of the number of these enterprises that are growing in Knowsley. Now, in the audience, we have Darren and, I've got my name, Darren and Martin, who will, so colleagues, endorse them in the usual way, with appreciation.
Thank you, Councillor Murphy. I would like to present Darren Roberts and Martin Nickelmore with a certificate in recognition of their work with the cafe. Would you like to come forward? This is just a small thank you from the borough for the amount of dedication you're giving, and I'm very honoured to present you with this. Martin, again, as I just said to Dan, we really do appreciate the hard work that you put in, like the likes of your groups. Mostly what we struggle, so we give you this small token with a great big thank you. Thank you very, very much. That was a quick get back. Public question time. One public question has been received. Can I invite Miss Colette Mill to ask her question?
Would the council please consider routinely recording votes at council committee meetings when the item in discussion is of high value or will impact a large number of residents? An example might be a housing or employment development debated in a planning meeting. Thank you.
Councillor Moorhead.
Thanks, Madam Mayor. Can I ask Councillor Bullwick to respond on our behalf, please? Thank you.
Okay, Mr. Wakeman, can I have a round of applause?
6 weeks. Thank you, Leader, and thank you, Ms Milne, for the question. The Council's constitution sets out how votes are taken at council and committee meetings and the circumstances when a vote may be recorded. Therefore, if the council was to adopt the position of routinely recording votes at all council meetings, as this question suggests, we would need to change the constitution. The council has recently carried out an annual review of the constitution, and we agreed some changes at the annual meeting. These changes to the constitution were adopted following full consideration of all the issues and implications. So, in answer to the question, I will refer the suggestion of routinely recording votes to the council's monitoring officer for consideration as part of the next annual review of the constitution. Thank you, Madam Mayor.
Thank you, Councillor Wakeman, and thank you, Colette Mill, for the question. Item 5, partners for presentation of Knowsley disability concern.
Thank you, Madam Mayor, thank you, councillors, thank you, officers. Thanks for the invitation. I'm delighted to be here to have a chance to talk to you about a real community aspect. These words, this phrase, gets bandied about quite often. Thank you, I forgot all about the microphone. I'm sure you can hear me anyway, yeah? But Knowsley disability concern, we believe, is a true valuable community asset. So I want to give you a bit of an insight into what we do, who we are, how we operate, and what value we actually bring to Knowsley. My name's Joyce Greaves, and I have the honour, and I'm very proud and privileged to be the Chief Executive and Operational Manager of Knowsley Disability Concern. Hopefully this 10-minute slot will be able to raise your awareness of this organisation that's been operating in Knowsley for more than 30 years now. We support your constituents and we contribute to the local economy. So by the end of this, I hope you'll have a good understanding of how we do that. Okay, so first of all, let's look at our vision. I'm going to struggle here because I've got a lot of slides. No. I'm pressing the left one. There we go. I don't know if you can read that from there, but it does say, and we have a very clear, driven vision. We want to see communities where all people are included, live independently, and are valued as equal citizens. So very much a very round belief there, and that's what all of our services are based on. When we start to develop plans for delivering new services, we look to our vision to make sure that it is in line with what we want to achieve. Okay, so who are our communities? People with learning disabilities, people with, sorry, I can't see either side here, people with long-term health conditions, people with physical disabilities, including sensory impairments, people with mental health problems, older people, children and young people, carers and families, and of course rest of the population of Knowsley. We're here for everyone and our services are free. Now let's look at what we do briefly as a community asset. Our core services, we provide direct payment support and advice and guidance to help people have control over how their care and support is delivered. We help more than 800 people use their individual budgets effectively, and that includes children with disabilities, older people, and those with continuing healthcare needs. That's 800 people. On average, we're bringing in 200 new clients each year using direct payments, and around 600 people use their direct payments to employ their own personal assistants or carers in their home, and those PAs, as we call them, personal assistants, come from their local community. That equates to 700 jobs or more, so bringing economy, boosting the economy. Part of our service is offering a free website, which is a job matching service for people to recruit PAs. We provide independent advocacy services through a citizens advocacy project and a crisis and issue-based advocacy project, helping people to speak up, be listened to, be heard, have a say in the issues affecting their lives and make decisions that are informed. We run the Knowsley Advocacy Hub, which is based at the Centre for Independent Living, which is the first point of contact for anybody needing to access advocacy, including those frontline professionals. The hub coordinates referrals, liaises with providers, makes sure the advocacy is of good quality, raises awareness, and promotes advocacy throughout the borough. We provide accessible information, making sure that the people are able to understand information that's published by anybody, including the council. So we work closely with the council's information team to make sure that easy read information, for example, is provided for people with learning disabilities, that video is used and audio information is used, and all of our own information is published in the same way. So we're champions there. But we also generate some income from this because we do offer a translation service to anybody from outside of Knowsley, and we're able to charge for this, and that brings income into the charity and income into Knowsley to help with our services. We provide a self-advocacy service, and that's an important part of our work, is actually helping people to speak up for themselves, helping young adults and older adults with learning disabilities to actually have a say. So we've got a very strong group of self-advocates. It's actually known as the Being Involved group, or the big group, and many of you will be aware of them. They come from all over Knowsley. And that service also encompasses some teaching in schools for young people and young adults coming through the system, so that they can learn the skills to be able to speak up for their wishes and views and their aspirations in life as they go through transition. A very important part. We have a payroll bureau. Now, this, again, we can generate income. We deliver some payroll services to people living in Liverpool. That brings income into the charity, into Knowsley, and helps support some of our other services. Payroll bureau is essential for people who employ their own PAs, obviously to keep them in line with legislation and HMRC regs, employment regulations, and also, of course, the new pensions regulations that are now affecting these very small micro-employers. And we obviously offer, well, maybe not so obviously, but we are a point of advice, information and support, listening, signposting. We've got a wealth and breadth of knowledge of services and agencies and activities across the borough, so we're able to help people to get the support that they need if we can't provide it ourselves. And finally, we offer a managed account service, and this links into the very top of the pinnacle of the direct payment service. Where people are unable to manage a direct payment themselves, we'll do it for them. Again, this is an area that we want to develop because we can actually sell this to anyone in the country really needing this kind of service. We can do it for them. Okay, so moving on to how we help people have a voice. The big group I've already spoken about. Active group, more than 120 people, meeting regularly, focusing on all sorts of issues, health inequalities, stamping out hate crimes been a big focus, ensuring there are reasonable adjustments, and they look at jobs, housing issues, transport, social care, and acting as a consultancy group for policy decisions and service developments. Advocacy partnerships. I've spoken about advocacy, but this picture is Debbie, who is one of our volunteer independent advocates who was voted Volunteer of the Year this year, 2 weeks ago, during Volunteers Week, run by KCVS, Knowsley Council Voluntary Services, recognised for the work that she's been doing with a young lady who was, as a result of an injury, was living in a residential care home with older people, basically living in her little room and having no real life outside of that. Her aspiration was to live on her own, in her own home. Her social worker said it couldn't be done. After 2 years, well, she's now been living in her own bungalow for a year. She celebrated a year there last week, and her life has changed completely. With the help of her advocate by her side, getting her through all the steps that needed to be taken, working with housing providers, etc., and the local authority social services. So that's a fantastic. And we help lots of people. I've got examples here, book time events. In terms of volunteering, we have on average 15 to 20 volunteers at any one time at KBC. For a tiny organisation, that's more than the staff we employ. And that doesn't count our volunteer board of trustees, of course. They're all from the Knowsley communities. Many of them are people with learning disabilities themselves, and they get the support from us to build their confidence. This is Angela, who answers the phone. If you ring us on a Wednesday or a Friday, you're likely to get Angela. And we recently have lost 3 volunteers because they actually moved out into full-time paid employment. 3 members of our volunteer team, having gained some skills, regained some good practice in administration it was, and now they're off and running, and we need to find some more. My next panel is around service views of voice, and that image is a little slice of the wall art that sits outside our premises in Highton. I know that some of you have been to see it, and I've been mightily impressed. It's a very, very powerful imagery of painted by people with learning disabilities, young people, about how they feel about their disability. And there's a video on our website that talks you through it, where they talk you through it and describe how they came up with the images. The image you can see there is a heart-shaped wrecking ball breaking down the barriers to independence. So that's interesting, and obviously there's an open invitation for any of you to come along and take a look. We make sure that people can challenge and feed in their views locally through all sorts of engagement forums. Locally through hospitals, patient experience, Health Watch, partnership boards, obviously the engagement forum, CCG, and regionally and nationally, recently with IHAL, Improving Health and Lives on Public Health in England, and the British Institute of Learning Disability. So our members actually attend those conferences. In terms of experts by experience, that's a picture of Linda, who on the 1st of August at the Anthony Walker celebrations will be standing up on stage talking about her experience of disability hate crime. And Linda's been through a lot, and she's come out the other side so confident and self-assured, and actually having a very different life thanks to the work that we've been doing with her. So we're really quite proud of that she's going to get up and speak. Some of the people we work with, we've supported to have training to enter and view, so to look at other services and comment. So that expert by experience view again. And some of our clients have actually been invited to visit assessment and treatment units in the wake of the last Board bill, where Connor Sparrowhawker was the young man who died needlessly in an HCU. And 2 people have been trained and do sit on recruitment panels, interview panels for senior healthcare staff. So we get all the inside info when they come into the office. work as a family unit. We run lunch clubs, and we help them to develop friendships and circles of support, and that's been very successful in a very tiny way. You know, with hardly any cost at all, any outlay. We're making a difference to about 18 families across Knowsley. And we've recently completed some work with a young couple whose child was in child protection proceedings. They both have learning disabilities, both have difficulties. We've supported them through over 2 years through court proceedings. I'm delighted to say that they've now got their little boy back living with them. So peer support is something we do naturally as a team, but we also offer it open to people who use direct payments to come together and share experiences and make the most of their individual budgets. We also facilitate peer advocacy for people with learning disabilities to support each other. And we've got a couple of partnerships going on now, helping to build confidence. And then I've got conferences, which I could go on about conferences. We do attend a lot of conferences. We don't always get a lot out, but I believe we bring a lot to the conferences we attend. Again, local, regional, nationally. But we also host our own conference here in Knowsley. Every November, we host a conference over the road. I have to think where we were then. And this year we're focusing on friendships and relationships. So that's over more than 100 disabled people coming together and talking about what it means and what they want to see happen to allow them to have full friendships, full relationships, and all that goes with it. So quite a controversial subject. Last year, the panel, the conference attendees, the delegates challenged a panel of experts ranging from legal professionals to the police, to local authorities, to housing, about disability hate crime. So that was very powerful. We run workshops. We completed a short session of workshops on the voting system, the electoral system. And you'll be pleased to know, well, I think you'll be pleased to know, maybe, if they voted for you, that 6 disabled people voted this year for the very first time. And they were older people, because they understood the system and they were helped and guided. So that was a result. And we just finished the first of a series of information workshops for employers around their duties and responsibilities under the new pensions regulations. So that's going to be a long one. We've got one next week on Wednesday, where we're looking at financial planning for the future, wills and trusts, and what people need to think about for their future and the future of their families, sons and daughters and siblings. Special projects, stamping out hate crime is a big one for us. That saw an unprecedented rise in the number of people reporting hate crime, particularly disability hate crime. So we're quite proud of that. Gave a lot of people more confidence. And I can talk forever about the little stories where people have said to me, you know, I went on the bus and this woman wouldn't move her pram and she said I shouldn't be there because I'm in a wheelchair. And, you know, he actually told the bus driver and he got reported and he got support. Great stuff, you know. We've just completed the hate crime project has culminated in the production of a DVD, which was filmed locally using local actors, disabled people, and it's a really powerful piece of video that will be rolled out to schools, and we've got the schools on board and we've got the Sigma unit on board, and we're just sort of planning how we're going to roll that out now. So again, the link to that will be featured on our website. So please feel free to have a look. In terms of partnerships, again, I could go on and on, too many to mention. We have a seat on the Health and Wellbeing Board and the Engagement Forum, and I represent the voluntary sector on the Adult Safeguarding Board. Other key partners, CCG, the new Ask Advice and Services Partnership, Health Watch, the Hate Incident Prevention Forum, the MASH, Housing Provider Forums, the Police and Fire Service. As I say, I could go on. And then we use consultations. We're currently helping people to have their say on the green paper. No voice unheard, no right ignored, and that's going to be interesting what comes out of that. Looking forward to hearing all about that. And the big group have validated the learning disability staff, the self-assessment framework last year, and they were actually invited by IHAL, Improving Health and Lives, to a national conference held in Manchester to talk about how they did that as a group so that they could share their best practice, and that was filmed, and that's going to another conference in Bristol. So we're starting to get a reputation for really engagement and good practice in those terms. We work with children to support the development of a new policy around STEM reforms, and we coordinated all the comments on the Adult Social Care local account. And we always promote any opportunity for engagement and consultation. Currently we're running the Accessing Knowsley Town Centres, which I help to compile as a member of the Physical and Sensory Impairment Partnership Board. So I hope that gives you a flavour, but as moving on as a community asset, that's the sign that takes you to where we are, and we are tucked away, so those of you that have been to visit us know where we are now, but if you don't, we're behind the Caldwell Centre on Tarbert Road. That's our building there, very small building. It is a community asset in itself. Premises are used by the community for all sorts of things, including people using rooms for interviewing, hosting fundraising days like we did on Friday. It was very fun in the weather that we had. But obviously our assets are our staff, 14 staff, very professional, qualified, enthusiastic. 5 of them are Knowsley Council taxpayers, they come from Knowsley. They're all in permanent employment. And we have the Investor in People Awards, so that demonstrates that we do really value and invest in our staff. Our volunteers that I've talked about, again, coming from Knowsley, who are benefiting from the support and training and improving their employment prospects. Our board of trustees, 5 of whom are disabled people themselves, and together possess the skill mix to drive KBC forward and govern well. We have strong policies that are enforced, they're relevant, and regularly reviewed against practice, so the staff team gets involved in policy as well as the board, and a clear set of values, very much values driven, common purpose, shared understanding about what I call our values is the way we do things around here, the way we work around here. You know, we can say that's not the way we do things around here. Partnerships we've talked about, but they run right across the health and social care spectrum. We're a founding member of the Knowsley Voluntary Sector Consortium, Forward Together, and we love joint working. We co-produced the Council's process for direct payments, and we were a member of the steering group for the Centre for Independent Living, so we love those opportunities to influence. And we've recently been invited to represent disabled people on the Merseyside Police Sexual Violence Reduction Steering Group, of all things, because I don't think there's anybody else in Merseyside. Anyway, there you go. Our IT systems are an asset. They're secure, they're fit for purpose, and they're up to date. We've just bolted on a piece of software to manage the pensions through our payroll system. Our website and social media. The website was designed by people with disabilities. It's easy to use and accessible. And we use Facebook and Twitter, and we really welcome the sort of the culture of mobile technology and being able to reach out to more people more easily and using smartphones and that sort of thing. We're working a lot on that. And KBC Connections, which is our job finder, job seeker, PA finder website. So they're our assets. What about our aspirations for the future? Future plans and ambitions. Hopefully that's the direction of travel, up and away. Firstly, number 1 on our business plan this year is to re-secure our contracts. They are up for re-tendering. We do exceed our service level agreements regularly. We do have a good history of successful tendering, so hopefully we'll be able to make sure that we retain our existing contracts. However, we're not sure yet about the commissioning plans, so we're not sure what we'll be able to actually deliver under contract and what's going to be procured and purchased. Alongside this, we'll be making bids for grants, but that's getting ever more difficult because of the increasing austerity and other charities looking for the same money, so more competition. We want to see direct payments increased and broadened out, more people taking up direct payments for personal health budgets. We want to see systems working across health and social care to make that happen. We want to be able to influence that and support that development. Targeting people with mental health, who use mental health services, to use direct payments more often, and children's services, children with disabilities using direct payments, particularly as part of the new health, education and care plans. We also want to increase training and awareness, so use our expertise to embed best practice in the Equality Act, promoting direct payments as an effective method for self-directed support that really does bring benefits to whole ranges of people. And raising awareness and improving take-up of training qualifications for that PA workforce. For those 700 people who are working out there, what about their training and development needs and qualifications? Social enterprise is up there because we want to see the big group become a community asset in and of itself. We'd like to see it being independent, self-funded through grants and trading activities, for example, delivering easy read, consultation, training and actual translation, so that we think there's real opportunities there for people with learning disabilities to have real jobs and a stake in society. We're quite excited about the work that we're going to do around that over the next year or two. And finally, support planning and care navigators, which we know is very much on the agenda. But using our connections, we're on people's doorsteps, we see them every day, we're out there visiting people in their homes, and we're on the phone, and we know about the local amenities, the local groups, at street level. So we have all of that knowledge, and we'd like to put that to good use through the sort of navigation of the care pathway and planning, care planning. We want to be there helping people to stay well, combat social isolation and tap into their neighbourhoods. So we think that innovative support plans and integration of formal and informal support is really the best way for meeting some of those assessed needs and the unassessed needs. I think that's it on that. But all of this is in the context of the financial challenges. We appreciate the continuing austerity measures and the cuts to services and having to save money. We're doing the best we can to make more of our assets, deliver more for less. The prevention and delay agenda, obviously, that certainly fits in with our support planning agenda. The health and social care integration, so working closely with both the CCG and the council to make things happen. And of course, the Care Act, the must-dos and the should-dos that are written down now, and how they will play out in health and social care, and what we can do to help make sure that people have their rights under the Care Act. Okay, so have overrun. I'm sorry, Madam Mayor. I hope you found it interesting. I'd like to invite any questions, but also to say that if anything struck a particular chord with any of the councillors or sparked a particular interest, I'd love the opportunity to talk to you a bit more and come and visit us and see us. So thank you.
Are there any questions before you put your hands? Can I just say, if you have a question, could we please keep it as short as possible, because I don't really want to interrupt you to moving on. So if you could make your questions short, please. Are there any questions? Well, can I thank Ms. Grace in the usual way, please? Thank you very much. Thank you. Okay, we move on to item 6, Public Health Annual Report. Councillor Eddie Conner.
That report,
Councillor Bill Wakeman. Are there any questions? Is that report agreed? Item 7, the annual report, 2014-15. Councillor Moorhead.
I move the recommendation, Mr. Mayor.
Councillor Bill Wakeman.
Can I formally second those, Madam Mayor?
Are there any questions? Is that report agreed? Item 8, councillors' representation. Councillor Moorhead.
Can I move the recommendation, Madam Mayor?
Councillor Bill Wakeman.
Can I formally second those, Madam Mayor?
Are there any questions? Is that report agreed? Item 9, joint authorities and combined authority. There are no questions have been received. Item 10, members' questions times. There's no questions have been received. Item 11, notions of a motion. Councillor Eddie Connor, I believe you have a motion you wish to the council to consider.
Can I move that motion, Madam Mayor?
Councillor Bill Wakeman.
Can I formally second that motion, Madam Mayor?
Councillor Connor, do you wish to speak on the motion?
Yes, Madam Mayor. The government announced further spending cuts to the... I do apologise, Madam Mayor and colleagues. The government announced further spending cuts to the current financial year, including reduction in public health grants to the local authority in the sum of 200 million. With no indication from the government prior to the 5th of June that such proposals were being considered, Knowsley has successfully set a balanced budget, including full allocation of the public health grants for 2015-16. Prevention is obviously absolutely crucial if we want to overcome the major public health challenges of smoking, obesity, physical activity, and we must accept that prevention costs money up front. But investment in services to address these areas saves money in the long term by reducing the demand on the NHS and social care. The Council firmly believes that it is more important than ever that the distribution of the available resources reflects the assessed needs of the area and the ability to raise resources. Unfortunately, the latest announcement follows those of the past 4 years, with the greatest impacts of the cuts likely to affect the most deprived authorities, such as Knowsley, the most. This Council therefore calls upon the Government to reconsider its short-sighted and contradictory approach to the proposed cuts in the public health funding, where it actually should in fact invest more in prevention and the health improvements where allocation is based upon need, and honour its previous commitments set out in the local government finance statement of March 2015. Thank you very much, Madam Mayor.
Councillor Wakeman, do you wish to speak on the motion?
Thank you, Madam Mayor.
Are there any other members who wish to speak on the motion? Councillor Sharp.
Thanks, Madam Mayor. If I was being a bit pedantic, I think I look at the conundrum of the title of that notice of motion. Opposition against public health ring-fenced funding reduction. You know, is it ring-fenced or is it a reduction? And I have to say that actually just demonstrates the deceit of this government. This government that before the election kept on saying, you know, the NHS is safe in our hands. You know, we are, not reducing the spending. We're going to increase the spending on NHS. And yet, the way they do it is by reducing the money, the money that goes to local authorities for that public health spending. There is not a medico in the country, there's not a medico in the world that doesn't agree that prevention is by far the most effective way to attack the biggest killers, the heart disease, you know, the diabetes, strokes, cancers. Prevention is by far the biggest way. And yet this government
has this very, very short-sighted attitude, mainly because they can blame the local authority when it doesn't work. Madam Mayor, I absolutely support this motion, but I fear that it will fall upon deaf ears.
Thank you, Councillor Shaw. Are there any other members who wish to make a comment? If there are no amendments, can I put the motion to the vote? All those in favour? Thank you. All those against? Any absence? Abstentions? I got it wrong again. Okay, then the motion is carried. Councillor Etikani, I believe you have another motion you wish to consider.
Can I move this to the motion, Madam Mayor?
Councillor Garcia, I believe you wish to second the motion.
Happy to second this motion, Madam Mayor.
Councillor Connor, do you wish to speak on the motion?
I do, Madam Mayor. Thank you, Madam Mayor, colleagues. The new psychoactive substance, often referred to as legal highs, presents a danger because they are easily accessible, they are changed constantly to avoid legislative control, thank you. They do not hold the same perceived threat to the health as illegal drugs. And many of our young people are unaware of the dangers that they pose. Increasing numbers of young people who have been referred for treatment due to their illnesses with either illegal drugs or alcohol are also users of these substances. The nitrous oxide one that we all see around in these little silver canisters was recently identified as laughing gas. We don't think there's anything to laugh about when the availability of these things is so cheap. The increasing the use of it with the young population is amazing. It's terrible. There's a risk of nitrous oxide being used in confined spaces which can really damage young children. And the problem is they're not educated about these things as they go along, and they need the government to really think about education more, because what we're doing is allowing our children to use substances they've got no idea what they do. So therefore I call upon the government to take more urgent action to protect our children, the young people, and an example of the undertaking of the national campaign to highlight the dangers of these products to the general public. Thank you very much, Madam Mayor.
Thank you, Councillor Connor. Councillor C, do you wish to?
Yes, thank you, Madam Mayor. Just in support of Councillor Connor's comments, I'm sure not many of us colleagues will have been able to walk around many of our streets and parks and not being able to see some of these canisters and being naive, as many of us can be, and I certainly am, not understanding what they are and going back and finding out what they are. Councillor Connor referred to how easy these things are to get, and when you check on the internet, you don't have to search very far to see how easy they are actually to get and how cheap they are to buy, without any restrictions on age. It's important to say, colleagues, that this is not a Knowsley issue, and it is important that we call upon the government to make sure that we do the right thing, which is to raise awareness and educate both our children and young people about, in most cases, Madam Mayor, the unknown effects of some of these drugs. Colleagues, I think it goes without saying that this motion is an important one for not only this council, but for the children and young people of this country, and therefore I'm happy to second this motion, Madam Mayor.
Thank you, Councillor C. Are there any other members who wish to speak on the motion? Councillor Connor, would you like to respond to?
I think everything's in the notice motions, Madam Mayor.
Thank you. If there are no amendments, can I put the motion to the vote? All those in favour? All those against? Any abstentions? I can't say that word.
Anyone not here?
The motion is carried. Item 12. Colleagues, there are no further items of urgent nature. I thank you all for your attendance, and I now declare the meeting closed.